Okay, on the accident plan, how does this thing work? Well, just be true to its name. It covers and helps to cover you in the event that you have a medical situation stemming from some type of accident. It could be any accident. It could be anything from an automobile accident to some of you guys may be into rock climbing or, surfing or whatever on the weekends. Whatever it might be, as long as the medical situation and the financial loss occurring from that was due to an accident. When you look through the plan design that's posted on the site, you'll see that first incident of treatment, whether it be an emergency room, a doctor's office, a hospital, whatever it might be, will pay up to $125 to help offset the out-of-pocket costs for that first incident of treatment. If they want to take some x-ray benefit, we'll pay $30 towards that. Up to 3 follow-up visits per accident at up to $50 per follow-up visit. You'll notice in there that two, I'd say, major components of the product. One, in that outline of coverage that's posted here on the site, you'll see dislocations and you'll see fractures. So if I'm dislocating or suffer an accident that dislocates a bone, a joint, and it's, say, a pinky, right, then maybe that's worth $100 or $110 or $25, unless they actually have to open up and do an open reduction. So if they have to surgically fix the situation, then the amount payable doubles, all the way up to $4,400 on dislocations. Now, obviously, we're not going to pay $4,400 if you dislocate your pinky. But on the other hand, if you dislocate your hip, so it may be in an auto accident or a skiing accident, and you actually dislocate a major load-bearing joint, then that would pay up to $2,200 for closed reduction or $4,400 under an open reduction. You'll see that the scales are pretty much the same for fractures. So if I have an accident, playing football on the weekend, whatever it might be, fracture my finger, then maybe that's worth $100 or $125. But if I wind up fracturing my skull in an auto accident, up to $5,500 on an open reduction basis. Burns, ligament tears, and tendons, and rotator cuffs, and concussions, and eye injuries, and lacerations, all of those things you'll notice in the outline of coverage are also covered as accidental injuries under this product and would pay benefits to you. The other major component, and on the outline of the plan summary on page 2, so that second half, you'll see benefits for surgery, abdominal, thoracic, or cranial surgery, blood and plasma that might be related to that particular condition, hernia surgeries as well. If you wind up transportation, if you wind up, maybe you're out on a four-wheeler in the middle of nowhere, or a hunting accident, those of you who hunt, and maybe you're out and need to be transported over 50 miles to receive care. Well, we would help offset the costs of the transportation. We'd also help to offset the cost of maybe a spouse or loved one coming to stay near you if they had to get a hotel room as a result of that till you could be moved. Hospital admission. On the hospital admission, what I kind of call up to sort of a normal admission, up to $1,500 against that. If it's an ICU admission, $2,000. Hospital confinement, $225 a day, unless you go in and admitted through the intensive care unit, which would be $450 a day for the first 15 days, and then reverting to $225 per day, up to 365 days per accident. You'll also notice, it's not on this slide, that if you wound up going to the hospital being transported by ambulance, $500 to the ground, and if you needed to be transported by air ambulance, $2,000 in benefits towards that coverage. If that accident actually takes your life in that unfortunate event, it does have a death benefit, $25,000 payable to a named beneficiary, unless it's a common carrier accident. So if it's a bus or an airplane or something like that, a train line, then the benefit would go from $25,000 up to $100,000. Many other benefits that I don't have time or room on the slide to show you, but they are outlined in your outline of coverage. And as you can see on this slide, the biweekly rates for the accident plan. You'll notice on this one that it is not based on the demographic or the age of the individual being covered, but only based upon the demographic of the household and who's being covered. So is it just the employee or full family or somewhere in between that drives the rate? And it is a premium that is pre-tax. We talked about pre-taxing. That would also apply for the accident plan.
And now the hospital income policy.
Assignment defined as an actual admission to the hospital with a minimum 20-hour stay. If you have option A coverage, then the company would pay $1,000 towards that confinement on a per occurrence basis. Option B would pay $2,000 on a per occurrence basis. Now, what does that mean? It merely means what it says. If I have maybe an auto accident or something that puts me in the hospital and I'm confined, I meet the definition of the confinement, and I trigger a claim, and Colonial pays either $1,000 or $2,000. Now, if I wind up coming out, discharged from the hospital, and I wind up going back in for a related issue within 90 days, then that would be considered a continuance and it would not be paid a second time. However, if I go in and I come out and go back in, even within 90 days for an unrelated incident, then it would trigger the benefit again. If I go back in for a related incident that is longer than 90 days away, then again it would trigger a second time and pay again. On the outpatient surgery portion of this, you'll notice in the plan design posted on this site that it's broken into two tiers. Tier 1 procedures will pay up to $500 towards those, and Tier 2 procedures up to $1,000 towards those, for a combined plan year benefit for outpatient surgery of $1,500. Now that is plan year. Those are not per occurrence numbers like the hospital confinement numbers are. Health screening benefit on this policy, you go get your annual health screening once per year. Notify the company if you have this product, this particular plan. Colonial will send you $50. Will that pay for it? No. But that is paid for in full now by your major medical insurance. All this is really trying to do is incentivize you a little bit to take an hour or two off of work and go get your annual exams done, once a year. Rehabilitation benefit on this plan, if I go into the hospital under confinement and I come back out and I need to go through a rehab unit, Colonial will pay up to $100 a day, up to 15 days, twice per plan year. This plan will ask a few medical questions, unlike the accident plan, which is a guaranteed issue product. When you sign up for this particular product, if you avail yourself of it, there may be some health questions asked of you, but the enroller will walk you through those at the time of enrollment. And on this slide, obviously, the rates on a biweekly basis. Now, you'll notice the plus sign, so option A and option B. The plus sign means that it is, in fact, an age-banded product. So, inside of the site, when you're looking at these plan designs, you'll also notice in the forms section that there is an election worksheet. That worksheet will show you the age bands and will show you the premiums for each age band based on option A and option B. So even though, and I've mentioned this at the top of this slide section, even though this particular product is age banded going into the product, it does not increase in premium as you age. So if you're whatever age band that you're in when you elect this particular product, you do not take rate increases. That premium will remain the same unless you make a change to the product at some point in the future. But it will not change simply with age changes. It also is a pre-taxable rate, just like the accident plan was earlier. Okay, next on the cancer plan, the cancer security plan. Same thing like the medical bridge. We've given you two options, an option A and an option B. This particular type of coverage is a little bit more specific, so really kind of targeted as an option for people who have perhaps a family history of cancer in their household. A family history of that, or for someone for just whatever reason is an issue, a concern of theirs that they have, and they might want some additional coverage on their finances in the event that they suffer from some type of a cancer. If you look down the plan designs, you'll notice that they're virtually identical in how they pay. The differences are going to be in how much they pay. The annual wellness screening, $75 under option A, or $125 under option B. If under that screening they find something that they want to take a secondary look at, maybe a little bit more invasive test, whatnot, then we'll pay that one more time per plan year to have those screenings done for you. We've built in an initial diagnosis benefit. Option A, option B, we've given a couple of numbers there. The reality is that is available up to as much as $5,000. So when you are enrolling into this particular product and talking to a benefit counselor about it, it can be removed, or it can be increased, decreased, whatnot on the plan. What it really is a separate rider that says that in the event that you have the product and you have a first or initial diagnosis of cancer, then we would pay out whatever lump sum that is that you purchased. And why might that be important? Well, I don't know about you, but if it was me and I went to the doctor for a screening and they kind of laid that on me and dropped that matzo ball on me, and I've got a cancer that I'm going to be facing, I might want to take a day or two off. No offense to anybody, but that's really what it's designed for, is maybe to give you a day or two, or help you to prepare for the fight, if you will, and a little extra money in your pocket to do that. The progressive payment benefit is along the same line. It is an optional rider that can be removed from the product if you don't want it, or it can be left on. Progressive payment benefit says that for every month that you have the plan and that you are not diagnosed with cancer, a separate pool of money will grow at $50 every month. So $600 per year for however long that you have the product that you've not been diagnosed with cancer. In the event then in the future that you do wind up with cancer and you are diagnosed with it, then whatever that particular pool of money has grown to, again, would be paid out to you as a lump sum to be used at your discretion for whatever you needed to use it for in order to prepare for sort of the fight, if you will, I like to say. You'll notice in the plan design that there are benefits payable for hospital confinement, benefits payable for medical imaging, for surgery, reconstructive surgery, radiation, chemotherapy, new and experimental treatment, stem cell transplants, bone marrow transplants, and then travel and lodging. We talked at the very beginning of the slide deck on this product line about what if you needed to be transferred to another facility. You're traveling over 75 miles or several hundred miles even to obtain treatment, and what about if a spouse wanted to come down and stay in a hotel room or something like that? Well, those costs are not picked up by Major Medical, but this type of product is something that would help you with that. This particular product, now, you'll notice does carry a 30-day waiting period on the benefits. So if you avail yourself of this product, if you take it, it's going to be effective on the first of a month, of the next month after you've applied. Do not, and this is the only time that I will ever tell you this, do not go get a screening done until the very next month. So a 30-day waiting period applies. If you do and they find something within that 30-day period, then the likelihood is that benefits would not be payable. So do not get a screening done for 30 days if you have elected this product. You'll notice on the biweekly rates that, again, like the accident plan, the cancer plans are not age-banded. They're only derived by who is being covered within the family household, whether it be option A or option B. And just like the accident and the hospital confinement plan premium, the cancer plan premium is also a pre-tax premium as well.